So I'm Dr. Arriel Benis, a senior lecturer at the Holon Institute of Technology in Israel. I'm dealing with digital health and particularly medical informatics for more than 2 decades, focusing mainly on artificial intelligence. And today I will show you two of our research also in collaboration with Professor Shayesh Kenazi, which present you previously other ones. And I will mainly focus on innovation during COVID-19 with public perception of vaccines and telemedicine. So it's our short agenda. We will discuss about how we can still fight against the COVID pandemic, how we are using the social media for or against this fight, or as a tool during this fight. And what about vaccines? Why we are talking and discussing about the new technology. Telemedicine, it's not so new, but for the grand public, it's look like. And we will then specifically focus on two of our research. One, focusing on the reasons for taking the COVID vaccine in the US, and reasons for utilizing telemedicine during and after COVID-19, and then how the public health implications. So two huge things for fighting the COVID-19, the vaccines. The mRNA-based vaccines have been introduced for fighting against this virus, and we had a lot of discussions and debates around the world about this technology and its potential effects. Then, even we are working with telemedicine for a long time ago, since at least the end of the 70s. During this pandemic, we pointed it out during the previous presentations, the grand public discovered it more practically. So all these technologies has been defined as innovative ones, and we introduce them in a rapid way, in an high way for the grand public. We asked also for broad vaccination and using telemedicine as a standard. And all these tools, like vaccines and telemedicine, induced some question for us as medical informaticists, as public health specialists, or health technologies experts. How can we really help to fight against the COVID-19 pandemic? If you remember, and we know the same pattern again and again with the different waves, we noticed during the different waves a huge increase in sick and dying people. And so using these technologies, fighting against people defined as opponents on vaccines and telemedicine was something critical. So with the current approach, or the classical approach, in research for understanding the reasons of the grand public of accepting to be vaccinated or to use telemedicine, it must take a lot of time and not having so simple to understand models for decision makers. So we decided to go on surveys and to run some data mining and machine learning processes for pointing out also and showing our discoveries in an explainable way. So first, and I'm not going deeper on this research, we, in parallel of the COVID-19 pandemic beginning, we started to search for the usage of and the adherence to the vaccination against influenza. And we started at the end of December 19 to download tweets focusing on vaccines, vaccination, and influenza. And we discovered that during around 1 year and a half, we didn't got a lot of tweets discussing about influenza, but more about vaccines, vaccination, anti-vax, and more particularly and increasingly about COVID-19. And all these discussions discussing about vaccines were debates about the mRNA technology, the pros and the cons. And it's very important to understand and to try to elucidate what are or who are the people supporting or not this kind of technologies. So if we are looking back in the media, it's very important to understand that the overall population was scared about this technology, the COVID-19 vaccines with the mRNA, and asked for getting answers to their questions. And it's critical to understand that the regulation at some time did not allow to share the scientific data from labs, and then the FDA released it. So on the second side, if we are not sharing data, or if we are not asking the right people, we had big issues on social media with anti-vaxxers. Going classically on social media to attract new potential opponents by sharing not fully relevant information, or by changing or adapting some contents. That's for the vaccines. Regarding telemedicine, regarding the mRNA technology specifically, it's very important to understand that it's not a new one. During the beginning of the 19th, so 3 decades ago, we started to work on for cancer treatments, and then for other diseases. So it's not a new technology, and the broad public is not aware about. If we are talking about telemedicine, also, it's really important to understand that we are effectively working on these technologies since the 70s, but we are working really with telemedicine for 100 years by asking with a letter, by calling a specialist and more. So the first research that I want to share with you today about it. And the results of this research are the reasons for taking the COVID vaccine, taking the COVID-19 vaccine by US social media users. And as we pointed out previously with Twitter and with tweets, we decided to share a survey. And it's a coincidence that it happened exactly during the period of the first FDA approvals online, and using a free way to share by sharing on social media platforms like Facebook, Twitter, LinkedIn, and others without paying. We didn't share this survey over a paying platform or by paying anything. So it was a huge work to get a response rate of 0.5%. So 1,728 answers, and we included effectively 1,644 data sets. So globally, with this Likert scale representation, you can see that it's look like that all the answers are relatively balanced, that people are taking the vaccine because they have some fear about being vaccinated, about the disease. They want to protect their families and more. But it's also a complex way to give to the decision makers our results. Then, by using different regression models, we also pointed out more clearly that fear of the disease, the need to protect our families, and the confidence on the healthcare providers and the pharma industry, something really critical, are reasons for taking the vaccine, and the civic responsibility. It's something also important there. But we decided to go forward and to use some more integrative approach for overcoming the Simpson paradox by building a decision tree as a data mining technique. And we discovered that the most important attribute was that people taking the vaccine or expecting to take the vaccine were mainly focused on their civic responsibility. It's right and also an obligation to be vaccinated according to this person. So 87% of the people that answered consider it as a civic responsibility. And then also something critical is that the same persons considered that they feel confident with the information provided by the pharmaceutical industry globally. And from this part, 74% took the vaccine. Even so, people which are not confident with the pharmaceutical industry informations were also influenced by the number of children. If they had not or a small number of children, they decided to consider taking the vaccine when they fear some complication about the disease. So we can see here that we had a lot of people taking the vaccine because they feel responsibility for the society, are confident on the pharmaceutical industry, and also feel fear of the COVID disease, something that we didn't know today clearly if we didn't fully understand the disease today, the virus today with its mutations. So the second one is with the same concept and the same approach is the reasons for utilizing telemedicine during and after COVID-19, because even we are vaccinated or not, we can be sick and we can need to consult a physician or a nurse, and even so, without talking about COVID-19, like Professor Ashkenazi pointed it out previously, any kind of consultation, the dermatologist or a cardiologist or a pediatrician, in Israel, for example, and other countries in the world, needed to be done by telemedicine for reducing social contact. So if we are looking at the telemedicine fields, it's a long process from the patients. We need to have user ID and to connect and to download some application and it can be too late. From the physicians and healthcare practitioners, we have an issue also about technologies. How and which kind of data are we getting? We can get. So at the end of March and the beginning of April 2021, we ran a survey, a multilingual survey in English, Hebrew, Spanish, Russian, French, and Arabic over the internet. And we had a response rate about, with the same approach that previously on social platforms without paying anything by posting on different groups, we got around 2% of response rate, and so 473 answers. And what's important to understand that the telemedicine, telehealth moved from the hospital to the smartphone during the last years, exactly like it happened with banking, from the ATMs to mobile banking. So our results has been divided in three categories, meaning that we got a lot of answers proportionally, 272 from Israel, and other groups from Uruguay, and the third group from other countries, for all other countries around the world, including some from Brazil. So the main factor for reason for utilizing telemedicine before, during and after the COVID pandemic is that we don't need to have an additional face-to-face consultation. We are not losing more time by traveling to the clinic, to searching for parking, and to waiting for the consultation. That's the main objective. So for people that don't want to have an additional, or expect to don't have an additional face-to-face consultation, another more than an half are expecting to get also prescriptions without going to the clinic, and it's critical. 40% of them are so using teleconsultation. In Israel, it's a standard to for before the COVID-19 to ask for prescription renewal, for leave or some other certificates during by over the internet or an application. More, if it's not for obtaining a prescription, it's also for people that help seniors were also more aware to use telemedicine. And then asking for an advice, only an advice before the pandemic is also something influencing the people for using telemedicine in Israel. In Uruguay, with 87 participants, we noticed that the main discriminant was if we have in the family users of telemedicine, and it's something critical. When you don't have, you are not going to use telemedicine because you will not also be someone helping seniors. People with someone using telemedicine also are looking if friends are also using this technology. And then something specific to this country, people buying their or purchasing their medications over the internet are more potentially telemedicine users. And if we are looking elsewhere in the world, it's with more than 100 answers. It's something similar to Israel. Additional face-to-face is not expected. Using social media also influence positively to use telemedicine, and asking only for an opinion is also something influencing. So not having, having the need to have a face-to-face consultation, and more not having the need to go to a specialist is influencing, and having an answer anywhere at any time is also something important there. So globally, when we are looking at vaccines and telemedicine, we are looking at innovation technologies or innovative technologies for the grand public and how we need to manage it. So firstly, we are taking, or people answering to our surveys are or were or will take the vaccine to protect their families and consider it this as a civic motivation, helping the community globally, protecting the community. And we have an issue there anyway. People which are not taking the vaccine are not trusting in the healthcare professionals globally, including also industry. When we are talking now the telemedicine aspects, we have we can understand that people with technical proficiency are working efficiently with telemedicine, are using potentially telemedicine more than others. Also, reducing queuing time and the way to use medicine without going to the clinic and visiting physically the doctor or the nurse is something important. And so this substitution effect of the physical visit by a virtual one is critical. So globally, when we are looking at both on vaccines and telemedicine, we have people interested in which one to take vaccines, to use vaccines, and to use telemedicine. And we need to develop retention programs, not losing these people over time and not having them engaged. So we need to have more technologies developed, but by focusing on health communication, supporting people which take vaccines and use telemedicine. Globally, and I will go over to the, I will take a short way to the public health policy implications. Today, we have an issue both with vaccines and with telemedicine. With telemedicine, we don't have regulation. We are not sure today fully of the clinical value at the long term. We are trying to reduce cost and to improve coverage. What about the physicians, nurses, healthcare practitioners, productivity and availability? What's happened with banks, it's also something very important to understand, but it's far away for the public to understand it on the same way. And what about people which are not able to use telemedicine and to understand and to learn from health communication when we are talking also about vaccines, elderly people, people with limited abilities, language understand issues. So that's what I wanted to share with you today. You have here the links and citations of both papers, and thank you for your attention.